The broadcast is now starting. All attendees are in listen-only mode.
Good evening, everyone, and welcome to this webinar on fundamental training for medical interpreters. Today, I'll be introducing to you our 40-hour training program, which, as many of you know, is a prerequisite to be eligible to apply for the medical interpreting certification, whether you're looking to get certified by the National Board or the Commission for Healthcare Interpreters. A few days ago, we sent you a link to our press kit where you could read about our school and instructor, yours truly. But for those who didn't have time to read it or didn't get that email, I'm going to introduce myself very briefly. My name is David McCoy Galicia, and I am the Director of Medical Interpreting Training School. I have more than 20 years of experience in teaching English as a second language, and I also have many years of experience in designing tests and programs for ESL students. Regarding my medical interpreting background, for the last several years, I worked at the most comprehensive and renowned hospitals here in Los Angeles area, and I have conducted thousands of medical interpreting assignments. I worked at the neonatal ICU, withdrawal of life support, pediatrics, organ transplants, and psychiatry. I've worked in almost every medical specialty, including medical legal appointments in workers' compensation cases. In addition, I'm certified by both the National Board and the Commission for Healthcare Interpreters. I shared this with you because I want you to rest assured that your instructor is someone who has extensive experience in both fields, teaching and medical interpreting. Now, before I start the presentation, I'd like to address some housekeeping issues. This presentation is going to be recorded so it can be available for you to review it later on. We'll send you an email with all the details on how to access the webinar. Right now, during the presentation, all attendees are going to be on mute mode. However, you can use the chat box to enter any questions you may have during the session, and I will answer your questions after each section or at the end of the presentation. If I run out of time and I cannot answer your questions, I will answer them via email. I think that covers the introduction, so I'll start with the presentation. Why was this program created? The Fundamental Training Program for Medical Interpreters was created to help aspiring interpreters have access to high quality training anytime, anywhere. So, if you live in a city where it's hard for you to find medical interpreting training or you have to drive to another city, this is the perfect program for you because we bring the classroom to you. Many of us work and have family responsibilities and cannot attend long hours or drive long distances. And what are the goals of this program? The main goal of this program is to develop your skills and competency, not just to take a certification exam, but also to achieve the necessary level of knowledge to effectively perform the duties of a medical interpreter in the real world. And how is this program developed? Well, the educational objectives of this program are derived from the guidelines and requirements outlined by the major medical interpreting organizations and certifying entities, especially the national standards for healthcare interpreting programs issued by NCHAC. What does this really mean? Well, in order to increase the quality of medical interpreting training, and as a result, the quality of medical interpreters, the National Council on Interpreting on Healthcare has, and I quote, set minimum requirements for what needs to be taught and, more importantly, learned before a candidate can practice as a professional medical interpreter. End of quote. So, you can be absolutely sure that this program aligns its curriculum to their requirements. You will be taught what needs to be taught and you learn what needs to be learned. What is special about this program? This program focuses on the practice and application of knowledge through realistic simulated medical encounters. You will have the opportunity to rehearse and discover new vocabulary by interpreting challenging medical documents, narrations, and doctor patient conversations as if you were in an actual medical encounter. You also find model suggested renditions of each exercise so you can analyze your answers and self assess your performances. So, as I mentioned before, I have a lot of experience teaching English as a second language. And one thing we all teachers and students can agree on is that we cannot learn how to speak a new language if we don't practice it. Students need to speak, practice, they need to be challenged, they need to make mistakes and correct them and practice again. Similarly, medical interpreting cannot be learned just by reading books or listening to other people's stories or other people's interpretations. You need to get your hands on it. You need to practice, make mistakes, correct them, and practice over and over. Our approach allows you to be the one in charge of your own learning needs, not your instructor. Unlike a conventional classroom, you'll have the autonomy to stop, rewind, review, and research any part of the lesson you feel needs more of your attention and reinforcement. At the end of this program, you will be sufficiently prepared to take any medical interpreting certification exam and carry out the responsibilities of a medical interpreter with adequacy. What you will not find in this program. In this program, you will not find a list of a gazillion medical terminologies for you to memorize. Although this is a medical interpreting program, it is also important to point out that this is not a medical terminology course. This program is about becoming a professional interpreter who works in the medical field and not a medical practitioner who interprets. We'll be learning the high frequency terminologies in context and through the actual practice of interpreting role plays and exercises. So, our approach is not that of 100 years ago when students were given hundreds of words to memorize over the weekend. In fact, that is not a very effective approach. Studies have shown that you hardly learn anything by reading things over and over and trying to memorize them. You learn by discovering in context and in interactions. Also, in this program, you will not be studying or reviewing basic anatomy or physiology. For example, ear, mouth, shoulder, or lungs, or simple vocabulary like nurse, disease, psychiatry, or fever. This program is designed for individuals who have a high level of bilingualism and are already familiar with the translation of simple words. Nevertheless, we'll provide you with plenty of resources for you to review and reinforce whatever you need to. So, in this program, I'm not going to spend our valuable time teaching you how to interpret nose, legs, or fingers, or teach you where the heart or the liver are located. That doesn't mean that these words are not going to be practiced. Yes, they will, but they'll be part of the exercises and not the focus of the lessons. All right, so now let's talk about the organization of this program. This program is divided in 10 different classes. Each class is to be successfully completed in 4 hours. That doesn't mean that you have to sit down for 4 hours to complete one class. You can take 1 hour today, another hour tomorrow, and so on and so forth. Due to the limited time in this webinar, I'm not going to go into detail and outline the objectives and syllabus of each class. However, you can find that information on our website. So the 10 classes are Basics of Interpretation, SPRI, which is an internal acronym which stands for Standards of Practice, Roles of an Interpreter, and Ethics. And then we have Interpreting in Cardiology, Endocrinology, Orthopedics, Psychiatry, Neurology, OBGYN, Hepatology, and Urology. Basics of Interpretation and SPRI, the first two classes, are the most theoretical classes we have. And the rest of them, as you can see by their names, are more practical. Those are the classes where we're going to be building and reinforcing our interpreting skills. So that is a total of 40 hours. Some of you may take a little longer to complete this program, and that is because you will have to review and dedicate more time to target and reinforce your learning needs. This program is not just a course for you to get a 40-hour certificate of completion. This program is a serious tool for you to study, to get prepared for the exam, and the real interpreting world. We recommend that you complete a class in less than a month. So, the fact that you have the flexibility to continue with the lesson another day doesn't necessarily mean that you're going to take an hour today and another hour in 3 weeks and another hour in 4 weeks. Your high level of commitment and motivation are also key to your success. So, please keep that in mind. Now, let's continue with the cost of this program. The cost of each individual 4-hour class is $80. To complete the 40-hour program, you will need 10 4-hour classes. That is a total of 800. If you want, that's if you want to buy each class separately as you go. Now, let's talk about what the 10 class package or bundle is. The cost of the bundle of 10 classes, which is the complete 40-hour program, is $640. That is 10 classes for the price of 8. Very simple. You get 2 free classes. So this is going to be the regular price for this whole package. Now, let's talk about the real special of the day, the early bird special. The Let me explain what this is. As of today, August 28th, 2014, the only 2 available classes we have are Basics of Interpretation and Spree. The remaining 8 are already finished, but they need yet to be recorded, revised, and uploaded on our website. Our deadline to complete the rest 8 classes is January the 30th. That is 5 months from now. So you can start with these 2 classes right now while we finish the rest of them. We'll be systematically uploading one class after the other. However, after a new class is released, the early bird special will increase in price as well. For example, right now, the early bird special is 400, and that is because we only have 2 classes, which is 8 hours of training. But let's suppose the cardiology class is released next week, then the price will not be 400 anymore, but 450. And then the endocrinology class is released 2 weeks later. Then the price will increase $50 more to 500, and so on and so forth until we reach the 640 regular price. But you don't have to worry about all that if you get the whole bundle early bird today, because you are guaranteed to have the 10 classes no matter when we released the new classes. So every time we release a new class, you'll find that new class in your profile. And the thing is that the longer you wait to take advantage of this offer, the less money you'll save because we will have more classes. But I can assure you that a new class will be released in less than a month, no matter, no more than that. We ask you for a month just to be on the safe side. So that's pretty much the early bird special of today. Today is 400. In a week, it could be 450. In a month, it could be 500. It all depends on how soon we release new classes. The longer you wait, the more classes we'll have, and therefore the price will be higher. And let me point this out. You don't need to have all 40 hours all together anyway. And that is because you are not going to take 40 hours in a matter of 3 or 4 days. That is something I wouldn't recommend. Overloading yourself with information will only obstruct your learning goals. You need time to process and absorb all the materials. You need time to review. You need time to rehearse, to repeat the exercises. After all, you want to be well prepared to take your exam and successfully pass it on your first try. So, this is the perfect opportunity and program for those who want to dedicate a few months to study and prepare well. Now, let's continue with the requirements for the program. To become a professional and successful interpreter, one must possess a high level of frequency in both languages and knowledge about the cultural aspects of language. Therefore, we require that you are truly bilingual. A high school diploma or equivalent in either working language is also recommended. At the present time, we are not asking for proof of level of education. However, it is important that you are aware of the minimum requirements set by any potential employer or certifying organization you wish to apply. What do I need to complete this program? All you need is a computer with internet connection, a functioning printer, and a recording device, a smartphone or a tablet, and also a set of headphones. Um, what are the benefits of this program? Well, there are many benefits, but I'm just going to mention a few. And first, you'll practice challenging simulating medical encounters, narrations, and documents found in real life that will also prepare you to take the oral certification exam. You'll answer more than 500 multiple choice and single answer questions that will help you prepare for the written exam. The instructor is an actual medical interpreter who knows the ins and outs of the profession, someone who has extensive teaching experience and is exclusively dedicated to the medical interpreting field. You set your own schedule and studying hours. No driving or sitting in a classroom for long hours. After completing this program, you still have access to all the materials, recordings, exercises, and model renditions. In that way, you can reinforce your skills and knowledge even the day before your test. So that's very important. When you're finished with this program, you are not going to be left only with a certificate of completion and a handout. You'll have access to all these tools you need to continue to strengthen your skills until you get your certification. I think that pretty much covers my presentation. Right now, I'm going to continue with some Q&A. Please, if you have any questions, you can type them in the chat box, and I'll try to keep my answers short and concise because I know it's kind of late for some of you folks that are on the East Coast. So if you have any questions, please write them in the chat box right now. And in the meantime, I'm going to answer some questions that were emailed to us beforehand. Number one, what does the program, I'm sorry, why does the program have only a few medical specialties? It's important to point out that the fact that the title of the class is, for example, cardiology, that doesn't mean that we're only going to talk about the heart. When we interpret in real life, doctors and patients normally veer off the main subject and start talking about other conditions or unrelated topics. For example, in psychiatry, the doctor says, "How are you feeling today, sir?" And the patient answers, "Not so good, doctor. You know, my psoriasis is flaring up again and my glucose levels are all over the map." So, even though this is a psychiatric evaluation, you are faced with dermatology terms, endocrinology terms, and idioms. So, you will get to practice and learn other terminologies within these exercises. That's how well designed this program is. So, the name of the class is the setting, but not necessarily the only thing we'll be learning there. Another question is, are you going to assess or review our work? I'm not going to listen your recordings or reviewing your answers. You'll find all the tools you need to self-assess your performances. You'll find answer keys. You'll have sample renditions. You for each exercise. After submitting your answers to your quizzes, you'll find the answers, which ones were correct, which ones were incorrect. So this is a tool and a program where you'll be able to self-identify your knowledge gaps and learning needs all by yourself. Next question is, are you going to interact with us? There is no interaction with instructor in these classes, and I'll tell you why. Many of you think that interacting with an instructor it's the best, and but this program is different, and it is different because let's suppose we decide to schedule a meeting like tonight. That would completely defeat the objective of the program. And let's say we do it. Okay, we have 2 hours to spare, and when we are all together, we have to share all the time with all the other students. And some students are asking things that are irrelevant to the class, or things that you already know, or things that were answered before, and even the instructor goes off topic and starts talking about something else. So your time is too precious to spend it on that. We learn much more by targeting your specific learning needs by yourself. This is a student-centered learning approach. Of course, if you have a question and that has not been answered properly through the renditions or the answer keys, please email me and I'll answer your emails in less than 24 hours. And if it's an urgent matter, you can call me and I will answer your call. So I may not be there physically or virtually, but I'm available to answer any of your questions. Now let's continue with what happens if the classes are not finished by the deadline you propose. I'm very confident that the classes are going to be completed by the deadline we mentioned, and even much sooner than that, actually. We're asking for 5 months just to be on the safe side. Nevertheless, if that were to happen for whatever reason, you'll be refunded the total amount of your payment. But that would be done only the day after the deadline. That would be January the 31st. So here's a question from Evelyn. She is wondering that she's a CMI and that she needs 32 hours of continuing education. Do you offer a 30 hour and a 32 hour, and do you have a package for that? Well, all right. If you're a CMI, Evelyn, you don't need 32 hours. You only need 30. And you have to turn in those 30 hours 3 months before your fifth anniversary. So I don't know when you got certified, but let's say 2 years ago, you still have 3 years to accumulate those hours. We do have continuing education classes, but so far we only have 16 hours. So, and there's no package for those hours either. So the package we're offering today is for interpreters that are not certified yet, and they need to comply with the 40-hour prerequisite. However, you are already certified and we do have continuing education classes, so you can take one of our classes one at a time, and I'm sure that by next year we'll have more classes, probably more than 30. Alegria asks, are the classes going to be available all the time? Yes, these classes will be available to you 24/7. I have students that have purchased their classes at 3 or 4 in the morning, and I noticed they finished at 7 or 8 a.m. So if you were on the East Coast or on the West Coast or even overseas, it doesn't matter. These classes are always available to you. That's why scheduling classes to interact with the instructor would be inconvenient. So you can start your class whenever you want. You can continue with it whenever you have more available time. They are available to you on demand. Olmanda wants to know if the whole training program costs 400 if paid today. Today, tomorrow, or in 2 weeks. It depends on when the new classes are released. As I said on my example, for example, a new class is released in 3 weeks or in 2 weeks. That is the day the price is going to be increased. And then 2 weeks after that, the price will increase again because we will release a new class. So today, yes, it's 400 until we release a new class. So I think that is all for questions. Right now, I'm going to show you how to navigate our website and how you can purchase our 40-hour program. Let me get to the website. One second, please. Okay, here we go. So this is our main page, our home page. And here you can see you have the complete 40-hour program, which is a pre-sale, because the regular price is going to be 640 and today is 400. Whenever we release a new class, you'll see that this price will increase as well. So you click on this image and then you're taken to the objectives of the class, and you have here the syllabus, and you have what I just explained to you about the early bird special. And right here, you have basics of interpretation, which is the very first class you have to take. So as soon as you get your program, you will have access to the very first class you have to complete, which is basics of interpretation. And then in less than 24 hours, you'll find the other classes that are available in your profile. And I'll show you how to get to your profile in a minute. So let's suppose we want to take the 40-hour program. So we take this course, and now we have to register. We have to create a username, and the username has to be one single word, no spaces, all together. For example, fellow interpreter, all together. And we're going to write the email. So we're registering. Okay, so now we have to create a password, something easy we can remember. Let me see today's date, for example. And now we copy the security code here, 3115C9, and we register. All right, so we're taking here to the cart. That's the where you have to write your name, your last name, the state you're in, and all your billing details, right? And then you have to accept the terms and conditions of the program and the classes. And right here, you write, you type your credit card number, the month, and the year of expiration, and the CCV, which is the number that's on the back of your card. So once you are done with all this, you place your order, and you will have immediate access to your class. You can go to your profile and you will find the class right here. For example, it will say basics of interpretation, or it'll say the 40-hour program. But before you do that, make sure to write your name and last name as you want it to appear on your certificate. Okay. So first name, last name, just as you want it on your certificate. So that's pretty much it. It's very, very simple. The steps are very simple. You go here, and then you take the course, and we already registered, so it took us back to the cart. So if you have any difficulties, you can email us or call us. We can walk you through it. 95% of the time, I answer the phone. So I think that pretty much covers my complete presentation. So take advantage of this great offer and start off your medical interpreting career on the right foot. I hope this answers all your questions and concerns about our 40-hour program and early bird special. But if you have any more questions, as I said, feel free to email us or call us anytime. Thank you very much for being here tonight. I greatly appreciate your attention, and I hope to see your name in our list of students. Thank you. Have a good night. Bye bye.